COVID and flu are not the only viruses to look out for in your children. Hospitals across the country are seeing a spike in patients with RSV. That's an acronym. We'll get to the meaning. It's a respiratory illness that hospitalizes nearly 60,000 children every year under the age of 5. CBS News contributor Dr. Celine Gounder is here with what you need to know. She's an epidemiologist and editor-at-large at KFF's Kaiser Health News. Dr. Gounder, thank you for being here. RSV, what does it stand for? What is it?
Respiratory syncytial virus, RSV. So this is another one of these cold viruses, kind of like COVID and the flu, can infect your upper respiratory airway. So that would be the nose, the throat. In that case, it causes a runny, stuffy nose, a cough, sore throat. But when it gets into the lower airway, so the bronchi, the lungs, in little kids that causes bronchiolitis, pneumonia, that can be a lot more dangerous.
Why does it affect little kids and how do they get it?
Well, when little kids get it, especially infants, they don't have mature immune systems, so they're not able to fight it off as well, and they have much smaller airways. So when you get inflammation in the airways, they get thicker. When you get mucus, you get plugging. So they just run into trouble a lot more easily.
But how do they get it, though? It's just one of those things?
It's one of these viral respiratory infections. So it's through the air, through droplets, just like you might get COVID or the flu.
How do we recognize it? What are the warning signs?
What's so scary about young kids is that they're very noisy breathers in general.
Yeah.
We're doing some work in the house right now, so Eloise is back in our room, and she doesn't have RSV as far as we know. But
You don't know if it's a cough or a running nose.
It's like grandma snoring in the next room.
Yeah, you're right.
It's that loud.
Wow.
And sometimes you ignore it as a parent because it seems normal.
So when does the normal noisy breathing of an infant become problematic?
Well, so if the baby's not feeding as well, if the baby's irritable, and then there are certain respiratory signs that you would really worry about. So if they're gasping, if they're wheezing, if they're coughing so much they can't really get a good breath of air, I would really start to get worried at that point.
Why are we seeing an increase now? 'Cause I had never heard of RSV before.
Well, I think a lot of parents of little kids will be familiar, and then the elderly also get pretty severe RSV. The reason we're seeing a big surge now is during the pandemic, we were masking, we were social distancing, and so you have all these little kids that were never exposed, and they're all getting exposed all at once.
So what should a parent do if they see symptoms?
Well, there's no way to know, is this RSV, is this COVID, is this the flu, without a test. And so just like for COVID, we have the PCR test, we have the antigen tests, which are the ones that you use at home.
Yeah.
We have similar tests for RSV.
Oh.
The only thing, though, is, we have those at-home tests for COVID.
Yeah.
They don't exist, the at-home tests don't exist for RSV. That would be a really nice tool for parents to have. Unfortunately, right now, you do have to go into a pediatrician or
You
to
just
the
recommend
hospital.
going in.
If you have those, if you have those warning signs, I would definitely go in and get your child
Do
tested.
they test them through the nose or is it a blood test?
This would be through the nose.
Through the nose.
Yeah, you would get a swab, just like for COVID
Just like-
or the flu. Yeah.
All
The
right.
hits keep coming, doesn't it? For us?
I know, it never ends.
No,
Yeah,
no,
it's not one thing, it's the other thing, or the other thing.
Yeah.
Yeah.
Dr. Celine Gounder, thank you so much.